Adam, welcome to Quality Health Finder.
Hi, Lorraine. Thank you very much for having me.
You are welcome. So, what are the most common sports injuries that you see in clinic?
So, in my private clinic at present, the most common sporting injuries that I see are ankle sprains and knee injuries, and throw in a few hamstring strains. These are often more low level, low grade, but it is sort of sport independent.
Okay, that would make sense. And what's the biggest mistake people make in the first few days of having an injury?
Often people just either do too little or too much. So they will often try and push through the pain, or often they will just completely rest. And actually, like with most injuries, a physio would just recommend sort of relative rest, but keeping as mobile as possible. And people often think that the injury is worse than they imagined or believe, or they actually think it's doing better than it actually is. So that's when they need to get an expert's advice and just make sure that they're doing the right things, because the things that we do in the first days and the first few weeks are very important.
No, absolutely. And what about ice and heat? People love a hot water bottle. Well, I do.
Yeah, no, no. So, and especially from a pain point of view, people always prefer a hot water bottle to cold therapy. But again, there's research that both can help. But especially sort of in an acute injury, ice is recommended, because what ice actually does is ice actually helps control the amount of swelling. Because the more swelling that is there, the more pain. So, whereas the healing response is triggered straight away, ice can actually delay that a little bit. And that's not necessarily a bad thing when the swelling is really vast or it's really painful. Whereas heat can then encourage the swelling to continue and the healing process to continue. But it's really important that you don't put heat on it straight away, because if the joint is already very swollen, it's only going to increase that, because it's going to increase the blood flow. And that will actually probably decrease our movement, decrease our mobility, and increase our pain. But ultimately, straight away for an acute injury, especially the first few days, 15 or 20 minutes use per hour can work well. But it's important that we move on from that after a few days, because otherwise the swelling can linger for quite a while, and the swelling then impacts our recovery negatively.
Okay. And is there anything that anyone can do to reduce their chances of injuries in the first place?
Yeah, yeah. So obviously making sure that our body is well equipped for whatever sport we're doing. So if we used to play football a lot and then we've had a few years out and we return back, that's going to massively increase our chance of an injury, because we've not played that specific sport for a while. And again, when people are doing marathons, they really ramp up the training to make sure that they can do it. People don't always do this with other sports. They just return from the sofa, um, and that can really increase our chance. So we want to make sure that if we want to go back to football, we practice the running, and we make sure that we're as strong as possible, really. Because if we've not done a sport in a while, the likelihood is, especially as we get older, we are going to get a bit weaker. So it's important that we maintain a general strengthening program at home or at the gym.
Okay. And how important is sports rehab? And how do you decide when someone should return to the sport?
So it's a great question, because I would say the rehab part is the most important part, because ultimately that's going to be the thing that gets people back to the sport. But more importantly, if done correctly, keep them in their sport. So when people come, we will assess, we will treat, and then we will start off with an appropriate program. I'm all for, with rehab, the best principle is progressive rehab, but that can work sort of both ways. Sometimes we have to make exercises easier if we're not going in the right direction. So often people need a few different exercise programs, really modifying and tweaking depending on the results of the objective tests that we do. Whereas obviously things like ChatGPT and Google can't see that. They don't know at what stage we're at, because the best exercises in the world from a research point of view are the ones that we should be doing later on in rehab, not straight away post an injury. But if you look into it, it's not always going to be able to differentiate that. So from my point of view, I then make sure our movement is coming back, our strength is coming back, and then we can obviously think about specific return to sport. And then you can throw in using objective data like strength testing, use a handheld dynamometer, what I literally put into my hand and ask a patient to do a movement, say, for example, push forward, and it will measure the strength. And I can then compare that to the sides. because we don't really ever want more than a 6% difference because that really can increase the chance of an injury. So if somebody is feeling good and their movement is 100%, but there is still quite a considerable strength deficit, we know that we're at the stage where we need to continue that rehab. Whereas if we don't use pieces of equipment like what I've just discussed with the handheld dynamometer, we are guessing, and that's been the issue in physiotherapy and other therapy sort of rehab, is the guessing part. As clinicians, we make educated guesses all the time. But if we can now use as pieces of equipment that can help us, it's gonna really help us give the patient the most appropriate program, but more importantly, help the patient, and it's gonna make sure that things are being progressed at the right time because that's the hardest part of rehab. The most common mistake is progressing too quickly or too slowly.
Yeah, no, absolutely. And in your private practice, what myths about sports injuries do you hear and you think, oh gosh,
Just where often people think, "I just need to rest it and then I'll return back to it." Whereas if you just rest it for a few weeks and go back to it and you've not done any training, it's actually, even though it may feel okay, it's actually gonna be weaker than it's ever been before. And then other people just say, "No pain, no gain." So literally
oh,
get straight back into it a week after, and they just make that injury worse or actually cause a new injury. Because if we keep, like, damaging our hamstrings, it can increase our chance of having a really significant, like, cruciate ligament injury, and that's what we have to be really careful of. We always try and nip these injuries in the bud, but they're the big ones. Just rest, either too little or too much rest.
yeah, okay, fair enough. And then with regards to the questions from our LinkedIn community, we've got one from Vanini who says, what is the best exercise to keep your back straight?
So, unfortunately, there isn't a magic exercise, but our posture is influenced by strength, mobility habits, that like working positions, things like that. So, the best approach is to stay active. That really helps. Avoid prolonged positions and really strengthen our upper back and core. But the big one is avoiding the same position. So, every hour we need to be just moving, even just for a few minutes. There is exercises that can help us. Keeping loose in our thoracic can really help us, but also things like bent over rows, bird dogs, and planks, they can really strengthen up our core and it can just support us. So if we aren't nice and strong, and we're used to being in this position, if I asked you to stand up straight and we didn't strengthen anything, that would actually feel more uncomfortable than how somebody felt before. So it's important that that we do strengthen areas before we just try and adopt, say, what people call the perfect posture. Because to me, the perfect posture is one that is pain free.
Yeah, of course, of course. Pragna asks, what's the best exercise to straighten the neck hump from excessive phone use? So the tech neck.
So I think that fits in really well just with the previous question. A lot of the same principles will apply just because when we are looking at our phone or on our computer, we are looking forward, our shoulders are rounded. So if we can open up that, squeeze our shoulder blades together, and naturally keeping nice and loose in our mid back, but even with our neck, ensuring that our neck isn't always in a chin tuck position, we can actually do what we call a chin tuck exercise. That can be done sitting, that can be done lying. It's just encouraging the movement. Because again, if I ask somebody to sit back and pin their shoulders back and bring their neck back, that would probably feel quite uncomfortable because they're not used to being in that position. So it's important that we strengthen up there. So that can be done with resistance bands, that can be done at the gym. There's always multiple ways that we can do it. It's always worth asking a physio for for a bit of advice. And types of injuries like this can really benefit from some manual therapy short term, but then longer term is where the rehab comes into it.
Okay. And then lastly, Victor says, what's the difference between a physiotherapist and an osteopath?
Yeah, so a question I get asked a lot. And osteopaths, there's also chiropractors as well. They have some differences, but a lot of similarities. The difference, and the reason why they are not used in the NHS as much, is they use a lot more manual therapy. That would be the crux of their treatment. Don't get me wrong, this is not to offend any chiropractors or osteopaths, because there is chiros and osteopaths out there who use more of a rehab approach. But physios have always been known for really sort of thinking about the rehab approach. So I would say people use chiropractors for short-term pain relief. Ultimately, often don't get to the root cause of the problem, whereas the physio will assess, find the root cause, treat any area as for a short-term fix, but think of the rehab as a long-term approach. And like I said, none of that is to offend, but that is how it is at the moment. But ultimately, it all depends on the clinician, because you may find a physio who only thinks about the treatment side, and you may actually find an osteopath or a chiropractor who is really focused in the rehab. So I think it's really important to sort of focus on the individual clinician rather than just the title.
Before we close, is there anything else that you'd like to add?
No, I think that's covered some really common questions. From my point of view, I'm on Instagram and Facebook, and I'm always happy to, and LinkedIn, obviously. I'm always happy to answer questions, even without an appointment. I get people asking if they're doing the right exercises, and people think that a physio is looking just for an appointment, and they're not. But what I would say is, if I've not seen somebody and assessed them, how do I know what is right for that patient? I don't. And that happens a lot. People say, no, I've got this problem. You know, you might be on a night out and people say, oh, what can I do for this? And there's a lot more that goes into it, because otherwise things can be misdiagnosed. So there's massive benefit to having a real detailed assessment. And I think more and more people are now using physiotherapists specifically, even when they aren't injured, more as like a maintenance to stop getting injured. And I think the past few years, the modern generation has really, really sort of focused on their health more than I've ever seen before. And I think that's why private providers are more popular than ever before, because I think there's massive strain on the NHS, and things like manual therapy aren't delivered as commonly in the NHS. But again, that comes down to the time. It's not that the clinicians aren't trained or anything like that. It's just the appointments are often a lot shorter than, say, a private clinic appointment. But yeah, if any other questions ever came in, I would be more than happy to answer them. Be more than happy to ever do another podcast. But hopefully that's helped people.
Absolutely. Thank you so much. We'd definitely love to have you on again. I'll make sure that I put your information in the description below. Thank you, Adam, for joining. And thank you also for being part of Quality Health Finder. If you found this conversation helpful, please share, like, and subscribe. And also, if you're a healthcare professional, visit qualityhealthfinder.com to create your professional profile and help patients like Adam does to find care. Thanks for watching. We'll see you next time.
Thank you.